You're listening to the RC Executive Lounge podcast, the show where healthcare revenue leaders share real-world strategies, hard-earned lessons, and bold ideas shaping the future of revenue cycle.
Hi, everyone, and welcome to an episode of the RC Executive Lounge podcast series. I'm your host, Praveen, and I'm thrilled you're all here today. Today's guest is someone I've been looking forward to speaking with for quite some time. We welcome Sandra Gubbine, a highly respected visionary leader in the revenue cycle industry, to our podcast today. Sandra Gubbine has held various positions in revenue cycle, up to and including assistant vice president. In her 30-year career in healthcare, she has overseen up to 300 professionals across patient access, medical audits, utilization review, financial counseling, and full revenue cycle operations. Sandra is also an adjunct professor at Rowan University and a Rowan MBA alumna, demonstrating a strong commitment to both education and operational excellence. She has earned her CPA, is a fellow of the Healthcare Financial Management Association, and has also earned a doctorate in business administration. Under her leadership, one of her revenue cycle teams earned the HFMA MAP Awards 4 times, highlighting her skill in driving performance and innovation. Sandra, welcome to the show, and thank you so much for joining us today.
You're welcome. Thank you.
Fantastic. Let's dive in. With so many pressures on finance and RCM teams today in healthcare, from payer delays to staffing gaps, how do you go about setting your top strategic priorities for the organization when looking forward 3 years ahead, as well as looking ahead for the next 1 year?
I think the thing that we always have to keep in mind is that healthcare is ever changing. You always have to be prepared for that. So to look forward to the 3 years or 5 years, sometimes it's harder and harder as the landscape is just so dynamic. But I think the best thing is investing in the right people and in the right process. When we put things together to improve our revenue cycle, collections, processes, you need to be looking at something and putting things in place that are going to be able to handle long term. If you're just reacting, you can't be in that reaction mode, because it's very easy to get in reaction mode in healthcare. Yeah. If you stay in reaction, then you never really move forward, and you just keep putting out fires like a firefighter. Yeah. I find that the best thing is to strategically look forward to say, what is sustainable? If we do these processes, can we sustain this to take us into the future? And are we using our people's skills up to the top of their skill talent? I don't need people to just be stamping paper all day long. That's not a talent that I need. So it's really looking at what resources we have, best utilizing them, and continually pushing them to the levels that they can be and the processes that are going to take this long into the future.
Thank you so much. Of course, as you think about these priorities, every organization has to make some very tough choices, right? Like, can you share an example where you had to say no to a good initiative in favor of something that's a lot more critical?
So interesting. Right now, I am working on a huge project of upgrading our revenue cycle systems at the current healthcare system that I'm at. And so I've had to recently tell someone that, they wanted something done, and that would have given us, probably given us some return in our old system that we're replacing in 18 months. And they're like, but if I have it now, it'll work. And I'm like, I'm sorry. The answer to that is no. It's no for more than one reason. It's no, not just because we're going to sunset the system, but it's also no because that talent of skills I need focused on our future and on our new system. I mean, yeah, you tell me that's going to help us, but it's not going to give me long term. because I really need to be focusing on new, not what's happening now. And actually, I had a second request come through, and I'm up against the same thing. The technology's not there. I realize this isn't a new problem. That's the other thing when you have to say no. You have to look in, is this a new problem? No, this is a problem we've had for 5 years. So
Yeah.
it can stay there, and we'll do the best that we can to bridge our gaps to get us over to the new technology. And it's not easy because people don't want to hear no.
Yeah.
And they're like, I know it can do it. I know it can do it. I'm not saying it can't, but we are limited in our resources. No organization, I don't care if you're healthcare or what type of organization, your top resources are limited, and they can only take on so much. So what is more important to drive our ship into the right direction than to step back and get a quick win?
Makes sense. When we go to events like HFMA or MGMA and all, we hear a lot about patient financing, denial prevention in almost every major RCM event, right? Where do patient financing and denial prevention fit into your strategic roadmap for this year or even for next year?
So we have gotten into some patient financing. We do work with a company to help, especially on the hospital acute care environment where, people are faced with huge deductibles. They need a surgery. They need, $5,000 up front to have it. So we have focused in on that. We've also working with Care Credit, which everyone knows is pretty common, to be able to accept that as a payment form so that people can get some 0% financing on their bills. So it is something that is always on the forefront. With the economy the way it is, and with the laws, particularly in New Jersey, where the laws are pretty strict about how you can pursue medical debt. You really do want to partner with the patient. So any type of financing that you can help patient, payment plans, that type of thing, interest free. We want the people that we can get to pay, get to pay. Also, I'm in a state that happens to have a pretty rigorous charity care program. So we do try to help people in any way we possibly can. So that really is important. And your second question being denials
Yeah.
is that's a never ending, we have found in the last 3 years that it's not just denials. We've had payers probably increase medical record requests threefold before they'll pay. So basically, there's the clean claim if it's clean in 30 days, whatever, but they're delaying that by, oh, well, we need to see the medical record before we can pay it, which is just another delay tactic. And also, if we don't send the medical record, we don't get paid.
Yeah.
So we have to have rigorous. So it's not just denials, it's truly having a dynamic process and team that can keep up with what's going on in the marketplace. What is the payers doing? They started about 5 years ago with DRG downgrades, and everybody was like, why worry about it? It's only a couple thousand here and a couple thousand here. Yeah, but when they're doing it 100 times, that's $250,000. And so it has actually gone into the millions of dollars that we've lost with DRG downgrades. So it's denials is a slippery slope because it's not just a straightforward denial. It's something I can handle because I know exactly why they denied and I can fight it. It's all these other things that are going on, the delay in payment, the request for records, the reducing of my payment. And so it really, the shops that are out there in revenue cycle have to think differently. If you're only focused on denials, you're losing a lot of money because it's not just in the denial environment.
That makes sense. Sandra, thank you so much for these insights. With that, let's take a short commercial break. We'll be back very soon.
This episode is brought to you by rchq.com. That's arceehq.com. The Agentic AI platform helping healthcare providers improve financial performance by simplifying patient financing and financial assistance. From faster approvals to fewer write-offs, RCHQ makes it easier for patients to pay and for providers to get paid. Learn more at rchq.com.
All right, we are back again with Sandra here. Sandra, thank you again for joining us today. I'd love to dive into a recent initiative that you led in your organization. What challenge were you solving for with this initiative?
So one of the big initiatives, and I think kind of brought us together, was that we did an initiative around our underserved population and our uninsured population. And so we implemented some software that we put into place to reach more of our underserved, uninsured. They're just as important. Honestly, the people who have insurance and can afford insurance, they're, funny thing, they don't like to pay their patient responsibility, but I'm getting money from those patients that I have to serve because I'm a nonprofit and I have to accept these patients. So we have really done an initiative, and it was hard. It was a hard sell to change workflow. We used to have a very reactive environment, paper driven. And so we were going to take people's paper away from them. We were going to put them on electronic work lists. And I can tell you it was difficult to manage the change, because basically the staff were like, this is the latest and greatest, it'll go away. And so if there's anything that I learned out of that project, is that if you really wholeheartedly, and I did very wholeheartedly believe in this project, you need to go in full force. Because one of the mistakes we made was we said to staff, we're going to pilot. Well, that said to them, well, once the pilot's over, it's gone. And so we didn't get the buy-in. So we realized that was a mistake. So we lost time. We also didn't invest in all what we needed to make the technology what it needed to be, because we thought, oh, we'll skip that step and we'll do that manually. And we realized that both of those were mistakes. We have learned, you really have to do the whole, if you're going to invest, you either get in or you get out. If you're going to go after a project, you have to go in at full force and you have to make that change. I mean, I would say that we would have seen improvements easily 12 months sooner if we had gone about the project in a much different perspective than what we did, kind of tiptoeing into the project rather than saying, no, we're going to do this. How is it best going to serve us?
Makes sense. And once you identified this challenge of introducing technology for the underserved community, how did you go about selecting a solution or a partner to help you with this implementation?
Well, we were fortunate in that we found a startup company, and they kind of found us. So that was really intriguing for us because we had never used any technology in this underserved, uninsured population. So it really just was a whole new thought process. We just had, it's always been, well, if a patient owes us, they'll just come visit the financial counselor when they get around to it. So it really was, we were fortunate. And I say now, I think I've learned a lot in working with this startup, challenging the company. So we found them was one thing, but we had to challenge them to meet our need, because what they wanted to do and what we needed weren't totally aligned. And I think that's with any partner that you work with. You're not always totally aligned. So you have to challenge. And that was one of the things when we found that partner The right partner is the partner who will listen to you and really be welcome to your needs and allow you to challenge them to be better so that we can be better.
Makes sense. And you talked about a few different organizational challenges. Now let's talk about implementation, which is always unique and challenging in a healthcare environment, given that EHRs and EMRs could be so different across different environments, right? So what did that look like? Were there any pitfalls, surprises, or lessons from a technology perspective that you could share with our audience here?
Yeah, I think the best thing is to truly invest and do your due diligence, because I think one of the things that happens, and I'm sure this is all organizations, not just healthcare, something comes along and you decide, yeah, let's do this. And you haven't looked at the entire how this is going to affect staff. How is this going to affect my technology? How is this going to affect my process? How is this going to affect my patient? So there was all of that to take into consideration. And I think our pitfall, and I alluded to this earlier, was not taking the full advantage of truly looking at that full picture and mapping everything out from the beginning, truly understanding what they can offer and truly understanding where we were, because we received so much staff pushback, not wanting to get on board. So if I would say the big pitfall was I really needed to pull them in and get them on, because people are, you can have all the technology in the world, but if you don't have the right people, it's 20% technology, 80% people. And so I think the biggest pitfall was that we didn't take that time to truly bring those people together and say, this is where we're going. What barriers do you see? What ideas do you have? Bring them into the implementation rather than just saying, oh, here's new technology. We need you to sign on. We're going to train you and go ahead and do it. I think that is a pitfall because in that particular situation, it wasn't a big implementation. So the smaller ones can be just as disastrous or ineffective if you don't walk through the right steps and get everybody on board.
That makes sense. And it sounds like you and your team went through a lot of challenges organizationally as well as technologically to get the project to where it is today. So can you talk a little bit about what has been the measurable impact so far and how have you been tracking success for this project?
So the interesting thing is with our financial assistance area, which is where this particular project was at, we had no metrics because it was all paper. So it was interesting, we would have them manage manual logs and different things, but we really didn't know what we didn't know. We did not know what they were capable of. And so we would set targets. And really, one thing we learned after we got in the technology, those targets were way too low. They were so much more capable. They were capable of doing 3 times as many assistances to patients, whether it be Medicaid applications or financial assistance. They could do 3 times what we thought they could do based on our old paper process. So how are we measuring it? We're measuring it because we have productivity that we just never thought we'd ever see. We're seeing it because we're getting increased dollars in our Medicaid, so yeah, Medicaid doesn't cover it all, but I'd rather have Medicaid than have nothing. Yeah. And we're getting patients assistance, which is really, this is kind of almost like a mission in a sense, because you're helping these patients stay healthy, help them understand the need. So we're reaching more patients, which that's just I think the best outcome is that we used to reach probably 10%. We now reach 100% because we went all in with the technology.
Awesome. Fantastic. Thanks, Sandra. So let's take a short break. Please stay tuned. We'll be back in less than a minute.
The RC Executive Lounge is proudly sponsored by rchq.com. That's ARCEEHQ.com, where Agentic AI is transforming how providers manage patient payments and financial aid. Providers using RCHQ are seeing more collections, less manual work, and greater access for patients in need. Visit rchq.com to learn more about the platform and schedule your personalized demo.
We're back online. Thanks, Sandra. So I want to shift gears a little bit into technology. When we go to a lot of these RCM events, you hear a lot about agentic AI playing a role in revenue cycle. What role do you see as an RCM leader in agentic AI playing in the revenue cycle, either this year or looking ahead for the next 3 years?
I really see that it helps. It's exciting, really. It really is very exciting because it helps putting the right information in front of the resources. My people are so important. So the Agentic AI can help me put the accounts, so if I'm a follow-up person, it puts the right accounts in front of them at the right time. Before it was a list. And how do you sort it? Alphabetic? Do you sort it by amount? What is it? Now it can be looking at, well, it's this payer, and this payer pays this quickly. So this payer hasn't paid yet. You need to call them. So it can take situations that, in my head, I know, but it's very hard to communicate that out. So this type of AI really helps. I think it's exciting because it takes people and takes their skill sets and lets them work to the top of their skill sets. It puts the right information rather than them spending an hour in the morning organizing what I'm going to do for the day. They can come in, and with the AI technology, it's sitting right there ready for them. It's already saying, here's what's important for you today. This is what you need to focus on. And it's just so exciting because I started in this industry over 30 years ago. And, it was literally, you got your paper out and you figured out what you're going to work on in the day, or you had a pile of paper that you had to work. So to have that kind of situation where the technology can say to you, this is your best way of using your time and your talents is so exciting. I just think it's the greatest thing.
Makes sense. And you're talking about agentic AI helping your team prioritize better, essentially, right? Outside of that area, in your mind, are there other areas where you think agentic AI or AI in general can be truly game shifting, not just incremental improvements, but like real 10x transformation for healthcare?
And actually, we're using it now. So where we're using it is we're using it to reach those patients. If I said to you earlier, in the area where we did our project, we were reaching 10%. Now we're reaching 100%. And I'm sure the listeners are going, yeah, right, they're reaching 100%. So the AI is going in and seeing patient came in, didn't have insurance, none of the people have been able to talk to them. There's no activity. And in 24 hours, it can send a message, text message to the individual. And what it does is it asks them various questions. And when it gets done, it sends them in and it kind of tells them, okay, you qualify for Medicaid, or you should go the financial assistance route. So that's the kind of thing that I used to have people sit on the phone and manually interview people, so you figure how many were we even helping? This is any person who's willing. I mean, now today it's you have a office appointment and they're texting you ahead of time, approve, change, do whatever. So here, this technology is actually taking the patient's answer, calculating on it and saying, okay, the next question should be this, and absolutely knowing that this patient, I stop going down financial assistance and I go down the Medicaid. So it's just amazing that's what we're using today. So, it's so futuristic in a mind, and uh, everybody has smartphones today. So it's just amazing. And how many people don't, they're practically attached to their smartphone. So it works great. They can sit there, they get the text. They don't have to get up and do a whole lot. They just need to answer some questions. And they can do that very quickly and find out that, oh, that organization really cares about me. And now, oh, okay, this is all I have to do. This is great. I just take pictures of things. So that's where we're using it today. And I can just see that growing more and more as you do that with, you could do that now with scheduling. I love it. If I can go in and self-schedule, and then if I don't like it's funny. You've seen how things have grown. I can remember years ago, you could schedule online, but you couldn't reschedule online. Yeah. You still had to get in the. So now you're starting to see that, oh, I can actually go and reschedule online, or they're even texting me to say, guess what? I have an appointment earlier for you. Would you like that? And so that's the kind of stuff that I think just makes our lives so much easier and just reaches more people.
Wow, these use cases really sound exciting. This is fantastic. Outside of Agentic AI, are there other newer technologies that you and your team are exploring or watching closely and you think would have a big difference for RCM in healthcare in the upcoming years?
Yeah, we're looking at a lot of technology right now, in the sense that one thing healthcare has struggled with is, particularly in RCM and in the patient accounting realm, is old technology. So we're currently looking at how do we better, what technologies are out there to make cleaner claims, so that our clean claim rate, needs to be in the 90s. It's not today. How can we also clinically drive our revenue cycle? It always was that the clinicians never thought they had anything to do with it. So we're looking at technology that pushes information up to them to say, this is what I need from you. And what we find is that it's not that they don't want to help, they just don't know they need to help. So we're looking at that kind of technology to get the question to the right person who can give the right answer, so that we get the best outcome from us, for financially, of course. But still, it's truly revenue cycle, or used to be patient accounting, the business office, right? Revenue cycle is the whole organization. Revenue cycle is huge. And I think that's where we, as an organization that I'm at now, is really looking on. Revenue cycle includes everybody, and people are jumping on board. They're excited to know that they can help. And so that's the kind of technology that we're trying to put in place. We have the big project that's going on, and we're out 18 months before we'll implement the new technology. But that's what we're looking at. We're looking at no longer, the patient accounting should just be collecting the money. Now we're looking at clinicians getting involved and truly educating, giving them the tools, right? You got to give them the right tools, give them the right education, and bring them along with us, so that we're all in this boat. It's not just the business office who's pounding on the payers to get paid.
Sounds very exciting. With that, let's take another short break and we'll be back soon.
Today's episode is sponsored by rchq.com. That's ARCEEHQ.com. If you're looking to reduce friction in patient payments and increase access to financial assistance without overwhelming your revenue cycle team, RCHQ's Agentic AI platform might be exactly what you need. Head to rchq.com to learn more.
Great. We're back with Sandra Gubbine. Sandra, I'm always curious, a leader at your level, what is the one metric that you obsess over and look at first thing in the morning?
Cash. I mean, the fact is, and I have the CPA, so I know you can record revenue. I know that you could put income statements together and you can make things look nice, but to be honest, it's cash, because it all comes down to, cash. And it's kind of funny because old school would be, well, cash is not revenue. But my argument has always been, if I don't collect the cash, your revenue number isn't any good. So it's all about the cash. Is the cash coming in compared to what you said we were supposed to collect? So that is that I live and die on that metric. Or where are we? I pull together budgets. I pull together to say and compare who's running behind, what payers aren't paying, why aren't they paying? This is the revenue that is on our profit and loss statement, but I got to get that cash in or that revenue is never going to be true in the long run. So cash.
Makes sense. And earlier, you talked about managing change, especially when you're implementing new technology or new processes. Of course, change is really hard, especially in a complex RCM environment of your scale, right? So how do you build momentum for change across your various teams?
So the big thing is, like I said, 80% people, 20% technology. So in order to make change, you really do have to communicate. I mean, you really have to pull people together. You have to get people involved so they feel as if they're part of the decision process. Sometimes people feel as if, oh, that's a lot of time being spent, but it's the upfront time that you spend with people to understand why we're changing, right? Because that's the worst thing, is to just say, here, your process is changing, and I don't tell you why. So it's bringing people together and bringing them knowledge. And I can tell you, being in this for so many years, there's always those people who are very resistant. And one of two things happens with them. Lots of times I'll say to them, just trust me. Can you give me 2 weeks of trying this? I've even had the situation years ago where I just couldn't get somebody to change and drop a claim because they thought the claim needed to be coded, and it didn't. It was an outpatient claim. I said, drop 20. No. Drop 5. No. Drop 1. All right, let's agree with 1. So she drops 1, and then I go back, and it was a Medicare, and I go back, so did it clear? Yeah, it cleared and it paid. Okay, so now can we drop 20? So in her, it was very hard for her to agree that what I was telling her was real. So sometimes you have to take smaller steps. Sometimes people are more than willing, but that's the exception. What's really, most people are, I'm comfortable where I'm at today. So change is about pulling people out of their comfort zone. So you have to get down and comfortable with them and say, look, I understand where you are. This is where we're headed. Do you want to be here? Because if you don't, that's fine. I can help you. I've helped many people move on. And I'm always supportive of that if it's not the kind of change they want to get into. But to be successful in change is, programs are easy. You change, you implement something new. But if you don't work with the people, the 80%, you'll never get the change done. And what will happen is you'll be never ending fighting why the technology isn't working. And like, it's not the technology that isn't working, it's the people who don't want to use it. So it really changes about, you've got to learn to communicate. You've got to learn to get into where people are at. I sit down next to them. So what are you doing that for? How do you do your job? I don't know everybody's job. This is how your job will change. So bringing them along so they feel valued, because they are. I mean, getting good people is not an easy thing. So you need to invest in that people change. That's how you get long-term change.
That's a very good lesson on change management. Thank you so much, Sandra. If you could give one piece of advice to another RCM leader or a CFO tackling similar challenges in a healthcare organization, what would it be?
I think my one thing of advice that I would give to any leader, regardless of level, industry, is learn to self-reflect. Learn to see how other people see you. So as I spoke about change, um, if if I go in and I think I'm helping people by telling them how to do their new job, they think of me as, oh, it's her way or the highway. But if I self-reflect and say, am I making sense to you? How are you feeling about what I'm saying? And truly take to heart, because some people will say, oh, that person's just a difficult person. No, take that feedback and put it in and take it to heart. Because if that's how this one person's feeling, there's probably a lot of others that aren't. So that's self-reflection. You need to be able to look in the mirror and say, how do people see me? Are they willing to trust me? Because if I don't self-reflect, I can't build trust. And so that is always my number one recommendation to any leader at any level in any industry.
I mean, essentially building that trust is hard, but once you build that trust, they are much more willing to follow you and, give you their full effort in any project you're trying to pull forward. So that's, again, great advice. Thank you so much, Sandra. One last question. Hopefully this is a, fun question to close the, podcast. What's a recent book, a podcast, a framework, maybe a television show that has heavily influenced your leadership thinking?
I would have to say that it does. I can't even remember the book, but it was the book that I read and learned about. I think it was servant leadership. It was, and it was learning to the self-reflection. It goes back to that. And it was an exercise that I did that was a 360. And when I first did it, I got results I didn't want to get. And I was like, wow. And so first I was almost angry, but then I was like, that's how people see me. So that framework, I still go back to that, is that ability to get to people. How are you taking me? Am I making sense with you? Watch body language. It's not just, are they rolling their eyes? Are they really giving you their attention? Ask them their ideas. So I still go back to, years ago when I did the 360s. And so that framework in my mind always is being open. I've never been someone that has to have a rigid plan, but I'm open to every opportunity. So never turn your back on an opportunity. Look at it. Is it the right thing to do? It may not be, but be open to it. I mean, there are people that have very rigid 5-year plans. That would stress me out. I'm going with the flow of what's happening, and I'm self-reflecting, and I'm just saying, you know what? There's an opportunity. Let's go investigate that. Is that the best opportunity for us? Being open-minded, and getting those opportunities from all angles. You may miss the best opportunity to make a change from the most unlikely place. So it's being that open-minded.
Fantastic, Sandra. Sandra, in today's session, you talked about one of the challenging initiatives in trying to help underserved population. You talked a lot about how you approach futuristic technologies like Agentic AI for RCM in healthcare. And you also shared some very interesting insights and lessons on leadership. I'm sure our audience would be very thrilled with all the insights you've shared in today's session. Thank you so much for joining us today. And I know that our listeners will walk away with very practical takeaways and a lot to think about from today's session. Thank you so much, Sandra.
Oh, you're welcome. Thanks for having me.
To our audience, thanks for tuning in to the RC Executive Lounge podcast series. If you enjoyed today's conversation, be sure to subscribe on Apple Podcasts, Google Podcasts, Spotify, or wherever you listen. And if you would like to be a guest on a future episode, head to rchq.com and look up the Revenue Cycle podcast series link to learn more. Until next time, I'm Praveen, and this is the podcast where RCM leaders lead the conversation.